Welcome back to the Voice of Rural Health, Maryland Rural Health Association's podcast. Today I have a special guest on with me, Chelsea Dade. Chelsea, would you like to introduce yourself?
Yes, thank you so much for having me, Jonathan. I'm Chelsea Dade, a public health professional, entrepreneur, and thought leader. And I'm the founder and owner of Communicate for Health Justice, CFHJ for short. Founded in 2018 and based in the DC, Maryland, and Virginia area, Communicate for Health Justice is a forward-thinking communications and advocacy firm mixing equity and social justice concepts into health communication ideas.
Well, welcome, Chelsea, and thank you for that great introduction. And I have a couple questions to start out our conversation. And the first one is really that rural healthcare, not only here in Maryland, but across the country, is often overlooked in the broader health equity discussion. Can you maybe share some of your perspectives on why rural health is essential for advancing health equity, as you mentioned, especially considering income inequalities and racial diversity in rural communities?
Yes, certainly. So, rural health is a critical piece of the health equity puzzle because rural communities often face unique challenges that contribute to health disparities. These areas may lack healthcare infrastructure, which makes it difficult for residents to access even basic services like checkups, preventative care, or specialized treatments. Additionally, income inequality in rural areas exacerbates these issues, making it even harder for low-income families to afford the health care they need. Health equity efforts must include rural communities because advancing equity in these areas has a direct impact on overall national health outcomes. While discussing about health equity, while discussions about health equity often center on urban and suburban areas, rural populations, especially those that are economically disadvantaged and racially diverse, experience severe barriers to care. There is an idea that rural equates to white, but that is actually far from true. A 2017 article by Vox titled "Rural America Doesn't Mean White America" explored this phenomenon. And 2022 research from the University of New Hampshire further demonstrates these changes. They had an assessment and they found that there are roughly 2 million fewer rural whites in 2020 than in 2010. In contrast, the number of rural residents who are members of a racial or ethnic minority actually increased to 11 million between 2010 and 2020. And moreover, as we see another tech boom with AI and other innovations, we should be making sure to include case studies made by and for rural communities, specifically ones that consider themselves racially and ethnically diverse.
Well, thank you for that thorough answer, which kind of really leads me into the next question. You mentioned, obviously, a little bit of the makeup of some of the misnomers of rural communities. But given your expertise, how do you think some of the unique challenges in rural areas, such as limited healthcare access, there's lots of economic disparities. We have a very low provider ratio for primary care providers. How do those all affect health outcomes affect for marginalized communities like the Black, Indigenous, and people of color?
Yeah, so the lack of healthcare access in rural areas definitely disproportionately impacts marginalized groups, like the ones you said, Black communities, Indigenous communities, and communities of color. For example, these communities, also known as BIPOC, communities in rural areas may have even less of a chance of having and maintaining local healthcare providers who understand their cultural needs or are equipped to address specific health disparities that they face, such as higher rates of chronic diseases like diabetes or hypertension. And so BIPOC communities are already isolated in some cases from the majority through some levels of structural racism. So if you add in this additional layer of a rural setting, it makes for a very isolating experience. Additionally, economic disparities mean that even when care is available, it is often financially out of reach. The hospitals serving areas without great access will then, unfortunately, be able to charge an arm and a leg and create a monopoly, overburdening its patients. Not surprisingly, transportation also remains a huge barrier. So, the combination of geographic isolation, economic hardship, and systemic racism in healthcare creates really a perfect storm for poor health outcomes. This is why targeted strategies that address both economic and racial and ethnic inequalities are essential, especially in rural healthcare policy.
Well, thank you for that answer. And you mentioned one thing that's very as a hot topic for a lot of rural communities, and that's transportation. And there's a lot of individuals that still struggle with transportation. Some of the what I call strategies in urban areas don't necessarily work in rural communities that don't have access to readily available public
Mhm.
transit, or don't have readily accessible vehicles, or even Ubers here in Maryland, but across the country, which kind of really leads me into one of another hot topic of conversation amongst a lot of my healthcare colleagues is AI and telehealth. They've been gaining a lot of attention here lately, especially within the past couple of years. But rural areas, often struggle with internet access and infrastructure. Broadband is still very limited in some areas. So, how do you believe that we can harness digital tools to effectively address some of the healthcare disparities in rural communities, like you mentioned?
Yes, thank you for that question. So, to fully harness digital tools like telehealth or even AI in rural areas, we first need to invest in the foundational infrastructure, namely reliable high speed internet. Um, I saw firsthand, the impact of the lack of internet connectivity when I was working in Chicago public schools when the pandemic happened. Students were completely shut out of access and forced into remote schooling, regardless of if they had internet access. And then you had the city rushing to coordinate access after the fact. And this is just an example from an urban setting. So, for a rural perspective, I remember when I was working during the COVID-19 pandemic, and I was leading targeted outreach in a select number of southern states. And so I was able to get in contact with an organization in rural Arkansas in order to do some of our outreach towards predominantly Black and Latinx Hispanic communities. And some of the tools that we had in our toolkit were overall mostly digital. And we were able to find a workaround which involved kind of creating a flyer for them to utilize. And then we were able to get those flyers to them. But, digital tools can sometimes only go so far. So, without this, even the most advanced digital health tools will remain inaccessible to those who need them most without that important high speed internet. But beyond infrastructure, digital health strategies must be culturally relevant and easy to use. For example, telehealth platforms should be designed with the unique needs of rural populations in mind, including language options for Indigenous or Spanish speaking communities and mobile friendly interfaces that work even in low bandwidth settings. These modifications should also be led by CBOs, community based organizations, in order to make sure that they're meeting those needs. And then I will highlight a resource that I've been seeing, be used, which in DC, Mississippi, and other states and organizations are connected through this collaborative called the Telehealth Equity Coalition, which could provide insights into how to invest and implement telehealth solutions into people who are listening, into their organizations and state governments. And so I would encourage listeners to consider connecting with this Telehealth Equity Coalition to see if they would be interested in becoming a member and learning more about this particular resource. And then finally, policy support for expanding rural broadband and providing subsidies for telehealth services could really go a long way in addressing these disparities.
Again, thank you for that answer. And I think for the audience, you mentioned a few different resources. So we'll make sure that we link those in the description, or any resources that are mentioned today, so they have them readily accessible to them. And coming up here in just a few months here in Maryland is our General Assembly session, our legislative session here in Maryland, which spans about 3 months. But also there's federal policies and legislation that goes on throughout the entire year. And policy plays, a very key role in shaping not only healthcare, but the access of healthcare. So from your work, what policy shifts are needed to ensure that all rural populations are prioritized in future health equity efforts?
Yes. So we need policy shifts that explicitly prioritize rural healthcare funding and infrastructure development. And this includes increased investment in rural health clinics, loan forgiveness programs for healthcare providers willing to work in rural settings, and stronger incentives for hospitals to maintain rural operations that don't overburden patients with higher costs. Additionally, policies should focus on addressing the broader social determinants of health in rural areas, such as housing, food access, and, as you mentioned, transportation, as these factors are deeply intertwined with health outcomes. And actually, just this week, the current administration announced an additional 75 million investment in rural health care for these very purposes. This funding will help launch and expand substance use disorder treatment, recovery, and social support services in rural communities. And that's around 54 million. It will also expand access to maternal health services in the South. That's around 9 million. And then support the viability of rural hospitals, and that's around 12 million. So those are just one example of action that's incredibly important for rural healthcare access. And this particular action will certainly assist in areas where Medicaid is not expanded, which can unfortunately leave many rural residents without coverage.
Thank you again for your answer. Here at MRHA, we'll be definitely looking into some policies that will definitely impact healthcare access here on the next few months as we continue to kind of bolster up our legislative efforts as we head into our Maryland General Assembly session. Maryland's put a big emphasis on health equity over the past few years, which we're really excited about. Some of the shifts and momentum that we've gained here in Maryland, and we look forward to continuing that. And lastly, for our listeners that really want to get involved with rural health advocacy, what are some strategies or actions that they can take to support some of this equitable healthcare in these often underserved rural areas, not only here in Maryland but across the country?
Yes, I love this question. So, for those looking to advocate for equity in rural health, one of the most impactful strategies is to amplify the voices of rural residents themselves. There are many tools to do this advocacy, but remember that advocacy efforts should prioritize listening to community members and understanding their specific needs. Communication research, strategy, and even program development should always start with a question of the thing that you're trying to learn, and really centering the communities that are most impacted.
Fantastic. Thank you for being a guest today. I think that, health equity and health equity communications and strategies are definitely not only a priority here at MRHA, but definitely going to be a priority, in the coming months and years here for the organization. And as we continue to kind of bolster our efforts to address and tackle some of these challenges that we've talked about today, you've often mentioned, several good resources for folks to get involved and resources that folks may not be aware about. So again, we'll be most certainly addressing and putting these resources within our description. We continue to get this podcast out. Is there anything else, Chelsea, would love to tell the audience while you have the floor?
Well, I appreciate, being on this phenomenal podcast and to discuss just a really important subject area. My first kind of entryway was through the pandemic and, seeing some of the major gaps in a solely digital approach. And so I just really appreciate the ability to learn more about rural health and perhaps find ways to better incorporate digital strategies in an equitable way for rural communities. So just really appreciative of being able to be in the space. So thank you.
Well, thank you, Chelsea, and thank you to our listeners for being on. And I'll close it out by saying, you mentioned during COVID, moving to a lot of digital strategies, and I was part of that at a health center where I had worked. Obviously, we had to implement, telehealth kind of from the ground up, and continuing to see some of those strategies promoted amongst these rural communities that again don't have access to broadband or don't have access to proper equipment like laptops and Chromebooks and cell phones. And so there are definitely things that we could be doing to make sure that that the access to care and the things that we're doing are equitable. And thinking about all the communities, and Chelsea had mentioned, really getting involved in listening and hearing from those communities. And I think that that's definitely a huge part of us continuing to work towards a more equitable healthcare landscape within the state of Maryland. So again, Chelsea, I appreciate you being on. I appreciate the listeners. Tune in next time to the Voice of Rural Health, Maryland Rural Health Association's podcast. Thank you so much, everyone.
Thank you.